Most people think dementia begins with severe memory loss, but doctors say the earliest warning signs often appear years before that happens, and many seniors completely ignore them. In fact, some of these signs seem so ordinary that families mistake them for simple aging, stress, or tiredness. But what if those small changes are actually your brain trying to warn you? Tonight, we're going to uncover 7 early warning signs of dementia that many people miss until it's too late. And you need to pay close attention, because one of these signs is so common that millions of seniors experience it every day without realizing it may be connected to cognitive decline. And number 5 is the sign doctors say families misunderstand the most. Let's begin. The first warning sign is repeatedly forgetting recent information. Now, forgetting where you left your glasses once in a while is normal. Everyone does that. But dementia-related memory problems are different. The brain begins struggling to store new memories properly. A senior may ask the same question multiple times within minutes, completely unaware they already asked it. Or they may forget conversations that happened earlier that same day. Family members often notice this first. For example, someone may repeatedly ask, "What time is the appointment tomorrow?" even after hearing the answer several times. Or they may forget that a family member visited earlier in the afternoon. At first, these moments seem harmless, but over time, they often become more frequent. And here's the dangerous part. Many families dismiss this as, "Oh, that's just old age." But doctors say persistent short-term memory loss is one of the earliest dementia warning signs they look for. And what happens next surprises many families, because memory loss is often not the first symptom people notice emotionally. The second warning sign is difficulty finding words during conversation. This is one of the easiest symptoms to overlook in the early stages. A senior may suddenly pause in the middle of a sentence because they can't remember a simple word. Others begin replacing words with strange descriptions. Instead of saying microwave, they might say, "that machine that heats food." Or they may lose track of conversations halfway through. Some people even stop talking as much because speaking becomes frustrating or embarrassing. And the scary part is, this can happen slowly over months or years. Family members may simply think, "they seem quieter lately." But what's actually happening may involve changes in the brain's language processing areas, and this next warning sign becomes even more concerning. The third sign is confusion with time or familiar places. This is where things become much easier to miss at first. A senior may suddenly forget what day it is, or become confused about appointments and schedules. Others may lose track of time completely while doing ordinary tasks. But sometimes the situation becomes much more serious. Some seniors begin getting lost in places they've known for decades. Imagine driving home from a familiar grocery store and suddenly forgetting where you are. That experience can feel terrifying. And unfortunately, many people hide these episodes because they feel embarrassed or afraid. Some families only discover the problem after a frightening incident happens. Now here's where the warning signs begin affecting everyday life more clearly. The fourth warning sign is poor judgment and unusual decision-making. A person who was once extremely careful with money may suddenly begin making risky financial choices. They may fall for scams more easily, forget to pay important bills, or give away money unexpectedly. Others may begin neglecting personal hygiene, medication schedules, or basic safety habits. For example, leaving the stove on, forgetting to lock doors, wearing inappropriate clothes for the weather, or eating spoiled food without noticing. At first, these moments may seem random, but over time, patterns begin forming, and doctors say these subtle judgment problems often appear earlier than people expect. But the next sign is the one many families misunderstand completely. The fifth warning sign is changes in mood or personality. This symptom often shocks loved ones the most. A person who was once calm and social may suddenly become suspicious, anxious, irritable, or withdrawn. Others become emotionally reactive over very small situations. And sometimes these changes happen before severe memory loss becomes obvious. That's why many families mistake dementia symptoms for depression, stress, stubbornness, loneliness, or simply aging. But dementia affects much more than memory. It can change emotional regulation, personality, and behavior. Some seniors even begin accusing loved ones of stealing items they themselves misplaced. Others become fearful or confused in situations that once felt normal. And sadly, these changes can create painful tension inside families who don't yet understand what's happening. Now here's something doctors say many people never expect. People with early dementia are often aware something is changing, even if they don't talk about it openly. That awareness can create fear, frustration, embarrassment, and anxiety, and that emotional stress sometimes makes symptoms appear even worse. Now let's move to warning sign number 6, difficulty completing familiar tasks. This is one of the clearest signs that the brain may be struggling with daily functioning. A senior who once handled routines easily may suddenly become confused doing tasks they've performed for years. Simple things may begin feeling mentally overwhelming. For example, following a recipe, managing medications, paying bills, operating a television remote, or remembering steps in a normal routine. And what makes this especially dangerous is that many seniors try to hide these struggles. Why? Because they're afraid of losing independence, afraid of worrying family members, afraid of what the symptoms may mean. So instead of asking for help, many people quietly struggle alone. And that's one reason dementia often goes unnoticed much longer than it should. But the final warning sign may be the most heartbreaking of all. The 7th sign is withdrawing from social activities and hobbies. Many people with early dementia slowly begin isolating themselves. They stop attending social gatherings. They avoid phone calls. They lose interest in hobbies they once loved deeply. And this often happens because social situations become mentally exhausting. Conversations become harder to follow. Remembering names becomes stressful. Making mistakes becomes embarrassing. So instead of dealing with that discomfort, they quietly pull away from others. Unfortunately, isolation may worsen cognitive decline even more. And family members often don't realize how serious things have become until the person is already deeply withdrawn. Now here's something extremely important to understand. Not every memory problem means dementia. Poor sleep, stress, dehydration, vitamin deficiencies, medication side effects, depression, and other medical conditions can also affect memory and concentration. That's why medical evaluation matters. But the difference is this. Normal aging causes occasional forgetfulness. Dementia slowly interferes with daily life, communication, judgment, independence, and personality. And the earlier warning signs are recognized, the better the chances of getting proper support and planning ahead. Now let's talk about something many people avoid discussing openly. Fear. For many seniors, dementia is one of the most frightening health concerns imaginable. Some people ignore symptoms because they don't want to hear bad news. Others stay silent because they fear becoming a burden on their family. And many adult children struggle emotionally when they begin noticing changes in a parent. It's painful watching someone you love slowly become different. But doctors say early recognition can make a major difference, because catching symptoms earlier may help families improve safety, manage symptoms better, reduce stress, plan ahead, and protect quality of life longer. And there's one more thing every family should understand. The brain depends heavily on lifestyle habits. Research continues showing that certain daily habits may help support cognitive health as we age. Regular walking and physical activity help improve blood flow to the brain. Social interaction helps keep the mind stimulated. Good sleep plays a major role in memory and brain repair. And managing conditions like high blood pressure, diabetes, obesity, and smoking may help reduce long-term cognitive risk. Nutrition matters too. Many doctors encourage diets rich in vegetables, berries, fish, nuts, olive oil, and whole foods because these nutrients may support brain health. Mental stimulation also matters. Reading, puzzles, music, learning new skills, and staying mentally engaged may help keep the brain active over time. Now imagine this for a moment. What if someone notices these warning signs early and takes action before things become severe? That awareness could provide years of better planning, stronger support, and safer living. That's why paying attention matters so much. Not to create panic, but to create awareness. Because the brain often whispers before it screams. And many of those whispers are easy to ignore until the condition progresses much further. If this video helped you, tell us in the comments. Which warning sign do you think families ignore the most? And have you ever noticed any of these symptoms in yourself or someone you love? Remember, growing older does not mean giving up on brain health. Small changes matter, early action matters, and paying attention to unusual symptoms matters. Thank you for watching, stay healthy, stay connected, and we'll see you in the next video.